Hi, I'm Dr. JC and welcome to another episode of Hair Talks by Terra Medical. Today we'll be talking about scalp micropigmentation, also known as SMP. I have included SMP in my hair restoration practice in recent years. SMP is pretty similar to other cosmetic services such as eyebrow embroidery. It is essentially tattooing ink in the superficial dermis of the skin at 0.7 to 1 mm, as compared to traditional tattoos, which goes into the deep dermis approximately 1.5 to 2 mm. Traditional tattoos use larger needles, while SMP uses smaller ones, and by keeping the ink superficial, it allows for more precision and prevents the ink from blotching and running its color. SMP is suitable for both men and women. However, patient selection is also important. Patients should not have any previously known ink allergy and should not be on any blood thinners. SMP is mainly used for covering balding areas such as receding hairlines, covering of parting lines of crown that are also visible under harsh lighting. Previous surgical scars such as patients post-FUE hair transplant with uneven harvested areas can also be corrected with SMP. So, the first step of an SMP procedure requires us to do a patch test. It has to be done at least 48 hours prior to the actual procedure itself. This is to check for any immediate ink allergies. A small area of around 50 dots will be made and observed for areas of itching and redness. If there are no issues, then we can proceed with the procedure itself. During the day itself, patients will be advised to wash their hair prior to coming. The area is clean with chlorhexidine and demarcated. Ink color would also be chosen based on the patient's preference, and the setting of the needle, such as the depth of ink, speed, type of needle, will be decided as well. The time taken for the entire procedure really depends on the areas covered. To achieve good coverage, I normally go over the same area a few times. Having tried SMP as a patient myself, during my training course, I would say that the pain level is approximately 0 to 1 out of 10. Most of the procedure is not painful and my first patient actually fell asleep during the procedure itself. Unfortunately, SMP is not permanent. The ink will fade in around 1 to 2 years. This is due to the superficial nature of SMP as compared to traditional tattoos. To give an illusion of good coverage, it is recommended that the ink dots are densely packed over areas, let's say the crown. There is no downtime except that we discourage you from washing your hair over the next 6 hours post-SMP. As for potential complications, they may happen, although really rare. Things like bleeding, infection risk is still present. SMP requires a certain level of detail. For example, when SMPing over hairline, it's important to use single needles to create a more natural, feathered appearance. Depth control is also crucial so as not to cause a blotchy appearance. Within the first week, do not shave your hair and avoid direct sunlight. Sunblock should also never be applied onto the scalp as it may trigger certain forms of hair loss. Post-SMP is also important to avoid intensive exercises or strenuous activities. Avoid swimming, sauna, or any other additional injectables of the scalp. In the long run, SMP will fade over time, and touch-up sessions are normally required. Using SMP to help improve density over the scalp is normally two-dimensional. To have a more realistic looking coverage, it is essential to have a certain degree of density already to give it that three-dimensional feel. My suggestion for patients with late-stage hair thinning is to consider seeking medical treatment first to increase volume, then stage the SMP procedure after to give it a more natural appearance. And that's all for Hair Talks today. If you have any questions regarding SMP, do leave them in the comments below. Otherwise, see you in the next video. Bye!